And together, we will move mountains. And if they don't hear our message, then we'll just do it over and over and over and over 1,000 times again for you.
And I'll rise up, I'll rise like the day, I'll rise up in spite of the end. I will rise, we will rise, we will rise, we will rise.
Hello, my name is Michelle Zabel, and I'm an assistant dean at the University of Maryland School of Social Work and the proud director of the Institute for Innovation and Implementation. So this year of working virtually has necessitated some really creative approaches to conferences. For us, we've spread the Training Institute workshops over the last 9 months, hosting just a few workshops each month. And I want to thank you for joining in these discussions and participating each month. This summer, we're continuing the Training Institutes in a way that will allow you to take us wherever you go. And I am hopeful that you are able to take a break and get away safely. We're going to be recording our summer workshops and releasing them each month so you can watch them anytime during the month that works for you. These workshops are going to be on a wide range of topics, all focused around strengthening your skills as you support children, youth, and families. A quick note, some presentation reference information and graphics that are embedded within the presentations may not be fully explained within the audio, but all of the presentations are accessible to download, as well as the resources and handouts that correspond to each workshop, and I encourage you to do that. Thank you for listening to the audio recordings of our summer workshops for Training Institutes Live. While you're enjoying these summer months and workshops, we'll be planning and working towards future Training Institutes when hopefully we can all see each other in person. Take care, enjoy your summer. Thanks.
Thank you for joining us for our Training Institutes, A Promising Path to Success System of Care Transformation. My name is Stacy Ray, and I have the pleasure of being the project director for Promising Path to Success Grants 1 and 2 for New Jersey's Children's System of Care. Joining me today as co-presenters from our Tri-County Care Management Organization are Deja Amos and Stephanie Suriani. Before we start to discuss Promising Path to Success, also known as PPS, I think it's really important to give you an overarching view of our system. New Jersey's Children's System of Care is a mature 20-year-old system that offers a wide range of statewide services for youth up to age of 21 who have behavioral health, developmental disabilities, and substance use needs. In 1999, we received our first System of Care grant, and within the next 2 years, thanks to the restructured funding, we no longer had to access care or services through our child welfare partners. From 2007 to 2012, we had over 300 youth that were in out-of-home treatment programs out of state returned to New Jersey. So we went from 300 youth who were receiving out-of-home treatment out of state to 3, and now we're at 0. We did that with the addition of services, including community-based, in-home services, out-of-home treatment interventions, as well as family support services. And in 2012 and in 2013, we actually had the addition of youth that have intellectual and developmental disabilities, as well as youth with substance use challenges that were added to our system. And then in 2015, we received our first of 2 consecutive SAMHSA grants for a System of Care expansion and sustainability, and that's PPS. So when we look at our System of Care values and principles, I think it's important to know our system as a whole. Currently, we have over 37,000 youth who are receiving care within our system. Over 15,000 of those are receiving care management services. We've had the closure of our state child psychiatric hospital, as well as we no longer have state-run residential treatment centers. We have the fewest amount of youth in detention centers. We've actually closed 10 of them. Currently, we have 832 youth that have behavioral health needs in residential interventions, and 315 youth with intellectual and developmental disabilities receiving residential treatment as well. So that means less than 10% of youth receiving care management services are receiving residential treatment interventions. But what we do know is the youth that are in our out-of-home treatment programs have the most complex needs and really need proper support and services to be successful. And so when we talk about residential treatment, we talk about it as an intervention and not a destination. And that's really where Promising Path to Success comes in. Promising Path to Success is a statewide initiative that combines the evidence-based model of 6 core strategies with the nurtured heart approach to build inner wealth in youth and families and our system partners, while supporting our system partners in creating safer, healing, and trauma-informed environments. But this is not just about out-of-home treatment. The role of our care management organizations, our family supports, our mobiles, all of our system partners are important in this initiative. Our system partners help to prepare youth and families with residential interventions. They help them to know what to expect when receiving treatment. And particularly with this initiative, they ensure that those standards are being met. We know that for youth to be successful when returning to the community, that all of our partners need to be working together in this work. And so our SAMHSA funded expansion grant, Promising Path to Success, is a 5-phase, 4-year grant that serves all 21 counties in New Jersey. It ran from September 30th of 2015 through September 30th of 2019 with a no-cost extension through March of 2020. In creating the Promising Path to Success vision, it was important to include the strategic goals of our Department of Children and Families, as well as the Children's System of Care. The Promising Path to Success goals really focused on the reduction of the percentage of youth that re-enter treatment after transitioning back into the community after their first initial episode. We also wanted to reduce the percentage of youth in the system of care that require multiple consecutive episodes of treatment. We also wanted to look at reducing the average length of stay, which at the start of the project was about a year, to at least 9 months or less. We also wanted to reduce and eliminate restraint, seclusion, and coercion. And lastly, with using the return on investment, we wanted to analyze and understand the impact of each of our system involvement in order to aid in making resource allocation decisions in the future. We couple the evidence practice of 6 core strategies with the language and lens of the nurtured heart approach. I'll discuss 6 core strategies more in depth in the next slide. My colleagues will share more about the nurtured heart approach in their presentation. But what I wanted you to know is that 6 core strategies is an evidence-based model that was presented in a 2-day training format that really provided a practical and accessible framework to guide trauma-informed culture within organizations. And the nurtured heart approach is really that relational approach that provides a language and lens to recognize the greatness in others, not just in youth, but in others, whether it's the youth and families that we serve or the staff within our programs. And really in order to build that inner wealth. And we do that through those 3 stands. Stand 1 being absolutely no, which is really refusing to energize negativity. Stand 2, which is absolute yes. And it's really energizing and super energizing success through active and experiential and proactive and creative recognitions. So really being able to show people that you see them and be able to share what you see as far as their characteristics. And then absolutely clear, right? Really being set in how your clear expectations. So you're being clear and concise and consistent. And you're doing that in a really non-energized way. And so there's really power in clarity, and there's power in resetting. And so we know that youth often that have intensity have learned that they get more connection from adults when things are going wrong. So this really, the nurture heart approach really allows us to be creative in helping them create new portfolios to build that inner wealth. And my partners, Deja and Stephanie, will discuss that more. With 6 core strategies, leadership towards organizational change is considered really a core in creating a healing environment. It's about really involving senior leadership because they define and they articulate the mission, the philosophy of care, the guiding values, and they communicate the importance of the implementation of this work. When we talk about data to inform practice, it really is about being able to use data, not only to collect data and disseminate it, but be able to analyze it in a way that's helpful to the organization and its members. So with our Promising Path to Success, we had folks that were able to analyze and look at restraint data. They looked at missing youth data. Maybe they looked at staff satisfaction. So really being able to utilize that data to improve upon your practice. 3 is workforce development. Although this includes training, it's not just about training. It really is a way to create a healing environment when we talk about our policies, our procedures, and our practices, and really ensuring that they're really grounded in the thorough understanding of the biology of youth, the neurobiology, the psychology, and the social effects of trauma, and knowing those effects and what violence has on the humans that we're working with. 4 is really that inclusion of youth and family voice and choice. And so for some, I think they initially thought that they were doing this because youth were able to pick their meals, or they were picking their activities for the week. But what we really talked about is this is really about having youth and families have a say in what a program looks like, what a program feels like, and how it operates. So it's not just that surface involvement. Next is the use of self-regulation tools, which really includes looking at the environment of care and sensory modulation. So how are we teaching youth and families about how they can self-soothe, and how does that translate not only within the program, but when they return back into the community? Really being able to have those transferable skills. And then lastly, that rigorous debriefing after events occur, so that maybe we can ensure that they don't occur in the future. And so really being able to gain some insight and knowledge from rigorous debriefing, utilizing that knowledge to inform policy and practice and procedure, so we don't repeat those in the future. It's also about really ensuring, once again, that senior leadership is involved in that, because they are really going to assist in promoting that organizational change. And it's really important to include everyone, right? Not only the youth or the staff, but maybe the witnesses, right? Because there's some vicarious trauma that occurs. And then lastly, it's really with that lens of no blame and no shame. And that's really important to this process. And so when we were looking at the implementation of Promising Path to Success, I think there were a couple of key components that we really tried to look at. We did a pre-kickoff of the Nurture Heart trainings prior to ever doing the full kickoff with each county. So that really provided the language and the lens for that entire county before we ever brought the initiative to their door. And then we did a local kickoff, and we did that through what's called our Children's Interagency Coordinating Councils. And those are groups of youth serving organizations that really help promote and share trends, gaps, barriers at the local level with the children's system of care, and they help with our initiatives in maintaining that at the local level. So having those kickoffs with those providers was essential to our work. Next, we provided that 2-day 6-course strategies training to our out-of-home treatment providers, our care management organizations, our family support providers, mobile response, and other partners, to really ensure the understanding of the initiative and 6-course strategies as an evidence-based practice. Then over the next 9 to 11 months, coaches met with individual out-of-home treatment programs, not with organizations, but with each individualized site, and really work with them through the 6-course strategies and using the Nurtured Heart approach as a workforce development training component, and really helping them to identify the areas that they felt that they can improve that particular program. And that allowed us to be really individualized based on the program, the staff, and the youth that they were serving. So as we continued to do the Nurtured Heart approach, we had certified a 5-day certified training, and then those certified trainers are able to meet on a monthly basis with what we call super user groups, or like a learning collaborative. So, we've all been to a training that we've loved. This really allows us to keep that fire burning. So being able to meet with like-minded folks and be able to hear about best practices, new advances, new training opportunities, super users have really helped us maintain that transformation on the ground level. And then lastly, really looking at our own state policies, our contracts, and our procedures, and changing so that they're in line with both Promising Path to Success, the 6-course strategies, and the Nurtured Heart approach. So now I'm going to have Deja and Stephanie talk about what this looked like at the system of care level with our care management organizations.
Thank you, Stacy. So Stacy touched on the fact that the Nurtured Heart approach comprises 3 stands, which are very purposeful and intentional ways of relating to those in our lives, not just the children that we work with. Think about how much time is typically spent attending to underperformers in a work setting, or those who need improvement or additional learning, as opposed to the superstars who model what we want to see in our workplaces. The nurtured heart approach involves awareness of the direction that our energy is flowing and righting any upside down energy. So absolutely no, absolutely yes, and absolutely clear. We have really made an effort to use all of these three stands in conjunction at our agency. We have not energized the negative. We have thrown energy behind the positive performance. And none of this is done in the absence of clear limits and rules, as Stacy mentioned before. Rules and limits and deliverables and expectations must be clear. A key piece of the approach is also the use of recognitions and resets. We have used recognitions and resets with detail and frequently at all levels of our team from a heart level. And we're going to share many examples of these with you as we move forward. The reset is the consequence piece of the nurtured heart approach, and it allows anyone who has gone off track to get back on track and regulate themselves when needed. The use of the nurtured heart approach, 3 stands and principles, and the 6 core strategies have truly created a relational shift at our agency. This is a picture of our staff, and we're also going to be sharing testimonials with you detailing our culture shift from the points of view of various staff members. Okay. So the next 2 slides actually show the testimonials from 2 of our care managers, so our direct line workers, who were both trained to use nurtured heart approach, and they both utilize it in their work with their youth and families, as well as their interactions with coworkers and outside of our agency. They both speak in these slides about the impact of working at Tri-County CMO, where we practice the nurtured heart approach, and how it impacts their work and their level of satisfaction day to day with their job.
I worked within the children's system of care for a few years before coming to Tri-County CMO, and one of the reasons I was interested in working here was because I would see employees at different meetings throughout the counties that we serve, and I was able to really see the changes that management was making by using the nurtured heart approach and the 6 core strategies. And they really aren't just tools that we use with the families that we support, but also within the agency to ensure staff satisfaction and promote a positive work environment. If staff are not satisfied, their work will be impacted, which will then impact the families that we serve. Management has really created an environment where staff can grow and feel appreciated for the hard work that we do every day. The nurtured heart approach and the 6 core strategies have really become embedded into every aspect of our work, whether it's when we're out in the field or speaking with other providers during supervision or during staff meetings. The nurtured heart approach and the 6 core strategies has really empowered us as an agency to continue to provide that really good support for each other and the families that we serve. I personally use nurtured heart every time I speak with a family or see a family. Many of the families that we serve may be at their breaking point, and when I meet with them and recognize even the tiniest thing that could be going right, it gives them hope to continue on their journey. By using the nurtured heart approach and the 6 core strategies, the families that we serve know that they have someone in their corner despite what they may be going through at the time. And also, my direct work with families is greatly influenced by how supported that I feel by my supervisor, my team, and the agency as a whole. Having a supervisor that incorporates nurtured heart and the 6 core strategies into weekly supervision provides a safe and supportive environment where I can continue to grow as a care manager and just as an individual in general. I personally feel that nurtured heart and the 6 core strategies has really been a game changer for everyone within the children's system of care.
Hi, my name is Ashley Dixon, and I'm a lead care manager here at Tri-County CMO. I personally have been recently certified in NHA approach, as my agency has given myself and others the opportunity to increase our knowledge and expand our abilities when working with families. Due to recent trainings, I've seen myself use this approach at work, home, and in the field. In the field, I now highlight several accomplishments and work off my youth strengths to acknowledge what they are doing that is exceptional. Although it may be challenging, I also assist parents with utilizing this approach as well. In the office, my supervisor, including all other supervisors, continue to provide support that allows me to feel confident in what I do. During supervision, my talents are discussed, and in turn, I build upon my assets. At our yearly anniversary, supervisors discuss with the agency the quality of work we continue to do. With continued positivity I see and receive, I become more assertive with my families. Our agency has created a space for me and others to utilize in need of a reset. I can log on at any moment when I feel overwhelmed and need to relax. I also enjoy listening to other accomplishments during our celebrations meeting and on our WOW channel. Words of encouragement of others allow me to remain and see the good of all. Thank you.
After a core group of us were trained in the Nurtured Heart approach and the 6 core strategies, we were tasked with the challenge of teaching everyone else at the agency and developing thoughtful ways of implementation. The buy-in started at the top with our CEO and our management team, who we trained in the Nurtured Heart approach and the 6 core strategies. We then formed work groups and solicited members from all levels of the agency, from office support to our management team, to focus on the key areas that we could implement these approaches. We settled on 4 areas: policies and procedures, work with our out-of-home partners, making our physical workspace more sensory friendly and Nurtured Heart approach informed, and engaging our youth and families differently and in ways informed by both of these approaches. We mandated Nurtured Heart approach training for all of our staff. And then we also had a booster training and continue to do that time to time to notch up their knowledge. We ensure that staff is using the approach with their families as well as with their coworkers in the office, and we continue to train new staff ongoing in this approach within 2 months of their hire. The cost for implementing these approaches has been minimal. We've used money for some small supplies such as sensory cart, sensory items, or the paint related to altering our physical space. The major cost has been in staff time, but we have determined it to be worth the expenditure.
Transforming how employees see themselves and helping them learn that they will receive the most recognition for positive behaviors is a part of NHA that we at Tri-County CMO really felt was important. And so we thought about our physical space and how we could infuse the Nurtured Heart approach and infuse the idea of recognitions into our physical space. And so what we did was we created things such as a WOW wall, where we used chalk paint, and just painted a wall, and staff can go in and write recognitions on the wall for other employees or for youth. We have a big glass window in one of our offices, so we bought glass markers, and staff can write recognitions and on the glass wall. I have the door to my office is covered with words that staff can actually take off and give to an employee. So if you see that someone's having a bad day or maybe needs a little bit of a pick-me-up, you can take something off of the wall and just remind staff of maybe how helpful they are, how creative they are, or how much you appreciate the work that they're doing. And then we also have a relaxation room where we made one of the office spaces that we had into this room, where we put in a comfy little sofa to sit in, a sensory cart that has coloring pages in it, and items such as squeezy balls that people can take out if they're feeling stressed. It has aromatherapy, and you also can play some calming music while you're in the room as well. So we did all of these changes just so that staff would be able to walk through the office and see a lot of positivity around them, and it has really helped keep up an encouraging and supportive work atmosphere. Another physical change that we did was we created something that we refer to as our why tree. So the work that we do can be very stressful at times, and we wanted to have a visual representation that would help staff connect to why they were here, to the reason why they were doing this work. And we felt that it would be a way to improve staff morale. And so in order to do this, we had a staff member who was really artistic paint this nice tree on a wall. And then we brought these leaves and we had staff write just a short statement on the leaf of why they were here. For example, my statement was, everyone needs help at some point in their life, and I wanted to be someone who helps. And that's what's on the wall. And so people could walk up to the wall at any point and just look at all of the reasons why their fellow employees were here. Once the pandemic hit, we didn't want to lose this idea of this Our Why tree, so we created it in a virtual setting. We had staff members make My Why videos where they actually on video talked about why they were at the agency or why they were social workers, why they were helping others. And we posted them to our virtual Microsoft Teams platform where people could access them at any time that they wanted, even while they were working from home. So if you were having a stressful day, you could take a break and go to this My Why channel and watch videos of your fellow employees for each video was maybe 30 seconds to 2 minutes. And it was really just like this short timeout that helped people get back on track and get reconnected to why they're doing what they're doing. So when you think about 6 core strategies and the idea of workforce development, we really thought that an important piece of that was how were we as an agency supporting staff and how were we promoting the idea of self-care? So we have these things with recognition, such as the WOW wall, but then what we also did was we sent out positive mindset screensaver link, and we sent out positive affirmations that were distributed to staff. We realized that we didn't have a debriefing crisis for after something happened, for after staff experience a crisis within their work. So we implemented something like that. We started a weekly mental health check-in group that moved to a virtual platform after COVID. And then our reset room, we actually made virtual. So the reset room it's a link to the virtual reset room. And each of the little icons in this virtual reset room, you can click and that would take you to whatever is pictured there. So you could click on the link to take you to play Sudoku because maybe you needed some time to relax. You could click on the music link and get connected to some really relaxing music. You could click on the Let's Get Fit album and that would connect you to some workout videos. You can click on the coloring page and then it would connect you to a virtual coloring page. And this was our way of taking our relaxation room and bringing it into a virtual space. Part of promoting self-care is also thinking about the emotional health of staff. While we are not their therapists or their doctors, we could think about emotional well-being and do things like a 5-minute meditation exercise at the beginning of meetings. We did an activity at a meeting where we asked staff to share quotes that were meaningful to them. And it turned out to be a really positive activity and staff were really engaged and really liked having the opportunity to share things that were meaningful to them. And then we created a PowerPoint presentation out of the quotes that were given to us. And then we also decided that we weren't going to ignore the racial tensions that George Floyd's death had exposed. So we started these affinity group discussions at work where we meet monthly to talk about racism and to talk about how that could be manifesting in the agency and to talk about how that was affecting our employees. We also created a wellness channel on Microsoft Teams where people could go and look at healthy recipes, or they could go and sometimes people would also post quotes there. And then we gave people options for virtual team building activities because we really wanted to make sure that people kept that connection. So even though we were all working from home, we still wanted to make sure that we were connected and we still felt like we were part of Tri-County CMO. So we did virtual team activities such as an escape room, and the agency actually gave funds towards making sure that teams would do this on a quarterly basis.
So we also incorporated the principles of Nurtured Heart and the 6 core strategies in the way we do supervision and evaluate our staff. So as a team, we reviewed both our performance evaluation and our supervision log template and revamped them to be more strengths-based in terms of absolutely yes, and engage staff more in their completion, thinking of workforce development and inviting more input from them. As far as considering the roles of resets, we were more intentional, as Deja described, about self-care and checking in during supervisions on staff stress levels, acknowledging when staff need to reset per the approach, and identifying ways that they could do so as individuals, but also helping move them along as an agency doing reset activities. We also developed ways to do very specific and intentional recognitions that we're going to show you several examples to honor our staff as modeled by the Nurtured Heart approach. I want to discuss an example of our agency's performance evaluation, which is really in line with the Nurtured Heart approach stand 3, absolutely clear. We make sure that everyone is clear on the expectations of their role and the deliverables that they need to complete. In this way, we're setting all staff up for success. Part of our performance evaluation is engaging supervisors in describing staff notable contributions and successes and their strengths. We also want supervisors to do this during weekly supervision, and thus we revamped our supervision log template to encourage supervisors during weekly supervision to discuss their staff's strengths during the past week. This might be intuitive that a supervisor would discuss positive things that staff members are doing. However, during supervision, it tends to get mired in the challenges that our youth and families present to the care managers, and oftentimes encouraging and recognizing staff might get lost. This is a statement from one of our newer care manager supervisors who was trained in the Nurtured Heart approach upon starting with the agency. And she discusses how the use of Nurtured Heart approach has informed her work with her supervisees.
Hi, it's Marnie, and I'm here to talk for a moment about the Nurtured Heart approach and how it has supported me in supervision. I think for me, the biggest thing is that it helps me to do a cognitive shift. In the busyness of a day or a week, when things are going wrong, it can feel very frustrating and overwhelming, and it might not set you up for the best way to address an issue or a problem that's arising. And what Nurtured Heart does is it helps me focus on taking a step back, being in the moment, and really talking to whomever I'm speaking with from a much more balanced and holistic place, making sure to look for those successes, even though sometimes it can be challenging to find them. If you're persistent and mindful about it, they're there to be found, and working from that sort of foundation. I think it's helped me to build trust. I think it's helped me to make a more genuine connection with members of my team. And I think that over time, it's helping my team be a better one. So thanks for listening.
As promised, these are 2 examples of specific and intentional recognitions of 2 care managers and their work with families. Part of Nurtured Heart is being specific, very specific and intentional in recognizing the work of staff members. Instead of saying things like, good job, we want to show staff that we're profoundly noticing their work and recognizing it by providing the details back to them. And we've seen that these very specific recognition in turn provide others at all levels to recognize their coworkers and other members of our staff. So I'm going to read these examples. And these are examples from supervisors to their direct supervisees. Kristen, I know this must have been tough to transition your last youth on your youth load. Thank you for all that you did for Sarah. You stood by her through all the ups and downs and ensured she transitioned to appropriate long-term adult services. You remained positive and advocated to no end. We are so lucky to have such a caring and compassionate care manager represent our youth and families. Kevin, thank you for your consistent follow-through with this family. There was so much going on, and you not only maintained ongoing communication, but you were persistent and professional with both parents and helped streamline information and remain neutral. Thank you for your dedication and commitment. So you can see how specific these recognitions are and how they would really show supervisees that their supervisors were really paying close attention to their work and honoring their strengths, instead of just saying something like, good job with the family. So as Deja discussed before, with the COVID pandemic, we had to move some of the way we practice the approaches to a virtual platform and really show creativity in our adaptation. So instead of providing recognitions in person or having resets in person that we could do as a group, we had to do this all virtually. So this is an example of our wall of greatness, and it's a way to do recognitions in Microsoft Teams. So what we did is we would allow people to go on Teams, write a recognition on the wall of greatness at any time for someone that showed a particular strength. And what we found was that once someone wrote a recognition on the wall of greatness, other people would then follow and expand the conversation and write their own recognition. And we found that it really was kind of a culture of contagion, and that people really use this wall of greatness very widely.
As Stephanie just stated before, we utilize kind of a committee structure to implement all of these initiatives within the agency. And one of the committees was responsible for looking at our policies, procedures, hiring practices, etc. And we created a sort of a mission just to make sure that we understood what the purpose of the committee was. And it was to communicate with kindness and relate to people on a heart level in order to grow their greatness. So we really wanted to look at our policies and just make sure that at the end of the day, the policies allowed people to get the work done, but didn't forget that we were all human beings with connections to each other. So some of the changes that we made are that we implemented a referral program for staff, so that if they referred a candidate who was hired, they then got monetary compensation for that. We completely revamped our onboarding process and created a structure where we had now a 2-day orientation that included a team building lunch, and also allowed new staff to meet all of management. We reviewed our exit interview form, made some changes on it. We looked at our staff satisfaction survey and made changes that were suggested. We revamped job descriptions to ensure that they were actually describing what the job was and what the responsibilities of the job were. We implemented a virtual suggestion box. Once the COVID pandemic happened, we made the suggestions box virtual, and it is actually monitored by our care management staff, not managers, just to ensure that people felt comfortable giving suggestions. And we report out on what those suggestions were on a quarterly basis at staff meetings. And we implemented something that we refer to as town hall meetings, which is an opportunity for staff to have virtual meetings with management where they can ask any questions that they have about how the agency is running. We also have staff celebration meetings twice a year, where we come and the point of the meeting is to just celebrate other staff members. So to just talk about something good that a staff member had done for you. We integrated Nurtured Heart activities into our regular meetings. So for example, within our supervisor team meetings, we do activities where we identify the greatness in other supervisors. We have thankfulness team activities where teams actually talk about what they're thankful for in life. It does not have to be connected to work. And we usually do it around the Thanksgiving time frame. We have a cultural share potluck. Obviously, with the pandemic, we did not do it this year, but hopefully with things returning to normal, we can do it maybe at the end of the year or early next year, where staff were encouraged to come and share a dish that was representative of their culture, and to also do something kind of like a show and tell, where they either dressed in something that they felt was an embodiment of their culture, or maybe they brought a picture. Some staff brought pictures of grandparents or family trees that they had made. We have an agency newsletter where we make sure we highlight success stories in every newsletter that goes out quarterly. And we implemented NHA-style recognitions to make sure that we were giving staff very specific positive feedback on their anniversary. And the way that staff were given that feedback was through the SARA technique. And SARA is a way for a person to utilize a formula to give a recognition of someone. And this was just, to get people to start feeling comfortable with recognitions and start feeling comfortable with the idea of being detailed. So the SARA is, what do you see or sense about a person? What do you appreciate about that? What does that reveal to you about that person? And saying that this is what that person is now, like you are. And then every recognition is always given from the heart. So it really is a recognition that you feel in your heart, and you want this person to connect with you. So we decided to use the Sarah technique to change how we did anniversary recognitions. Previously, our CEO would send out very generic emails that just congratulated the person for their time at the CMO, and that was it. There was nothing personal about the email. So we switched that up to now have the supervisor of the person write a Sarah that would go out in the email for all of the agency to see. And this is an example of what was sent out previously and then what is sent out now. So previously it would say, congratulations to Kevin on the anniversary of his first year with Tri-County CMO. Thank you, Kevin, for all you have done on behalf of the agency for the families in Somerset, Hunterdon, and Warren County. So we decided to change that up. And now this is what a new anniversary recognition looks like. I see that Kevin is always willing to help out members of his team. And instead of taking credit, he acknowledges them for allowing him to come out to meetings and teaching him how to do things. Also, no matter how busy he is, I see that Kevin starts a conversation by asking, "How are you? How was your weekend?" and really demonstrating that he cares about you as a person. I see him sharing parts of himself and funny stories of his daughter or his family, or sharing a funny show or movie he has watched. I appreciate that Kevin is helpful and also personable and just a general pleasure to work with. That reveals to me that he values being part of a team and not just working together, but knowing people on a personal level. Kevin, you are the greatness of helpfulness with humanity. I mean this from the heart. So this recognition is really just so much more powerful than what we were sending out before. It would really land with an employee, and they really feel appreciated and noticed, and like their supervisor sees who they are and sees the work that they're giving to the agency. And it also just reinforces that connection that we are looking for with our employees.
We've been talking a lot about how we as an agency have been accountable for the use of the nurtured heart approach and the 6 core strategies. However, we didn't stop at just holding ourselves accountable. We were thinking, how useful would it be just for us to be practicing these approaches if the system partners that our youth and families and staff interact with on a daily basis were not as committed to using the approaches? So since this is a statewide initiative, we wanted to collaborate fully and ensure that our system partners were showing the same levels of implementation that we were, especially our out-of-home treatment providers, where the reduction of seclusion and restraint and the use of the nurtured heart approach on their milieus was so crucial, as Stacy explained earlier. Therefore, in an effort to get these programs to see youth from a nurtured heart approach, strengths-based perspective, and recognize their greatness, we created some resources for them. We created a strengths-based face sheet so they could understand our youth in terms of their strengths and their needs, not some of the diagnostic information that they might get that paints a portrait of the youth as being very negative and having very negative portfolios. To maintain community engagement, we dialed in on youth who have been disassociated and disconnected from their communities for a long time, and we really made efforts to expedite bringing these youth back into the community. We collaborated with about 10 out-of-home provider agencies and discussed how we could help each other in moving forward with these approaches. And we even provided a joint parent nurtured heart approach training with one of our out-of-home provider agencies in our area. We took it upon ourselves also to convene quarterly nurtured heart approach system trainer meetings to discuss what trainings we have all been doing, discuss any barriers and ideas that we could share with one another. And those meetings were held with the system partners that Stacy mentioned earlier, our mobile response, family support organizations, and other out-of-home provider agencies.
So as I mentioned earlier, we created a strengths-based face sheet to help our kids be seen in more positive ways. So it was called All About Me, and it helped identify their triggers, identify what helps them when they're feeling stressed. So it also goes toward the 6 core strategies in terms of family engagement and sensory regulation. We also created questions that families could ask of out-of-home programs to make sure that programs that they're considering sending their children to were really in line with these approaches. So some of the questions were about, how do you keep my youth engaged in their community? How am I allowed to liaise with your program in terms of family engagement? And are your staff members trained in the nurtured heart approach, and how is it used? So we felt like that really helped our youth end up in positive treatment situations.
So we made all of these changes within our agency, and we really wanted to see what the outcomes of them. So we wanted to see, did these changes have an impact? And they did. There was a definite positive cultural shift among staff. A lot of the implementation of the strength-based approach in supervision actually resulted in staff who had previously been struggling, improving their work so much that they got promoted, 2 different staff members. We received feedback from new employees that the changes that we made within the orientation led to their best first week ever. Parents who attended some of the Nurtured Heart trainings that we did talked about how they received the tools to help their child with their behaviors, and it made them feel like they were not alone in managing with their child. And a community member wrote that the Nurtured Heart approach wasn't just about positive reinforcement. It's a practice that touches on every interaction and the opportunity each offers for building relationships, self-esteem, and success. We do an annual employee satisfaction survey in March of every year. And so we wanted to look at that as well as a gauge to see if these changes were making any improvements within staff morale. And we actually, for this past year, were pleasantly surprised to see that even though everyone was managing with the stress of COVID and the pandemic and all that that had brought with it, we still had 97% of staff saying that Tri-County was a good place to work. This was actually up from 3% from the previous year. This was actually up by 3% from the previous year. We did have some categories that went down, such as I have the equipment and materials to do my job, and I plan to be working here within the next 12 months, but we didn't really see that as a horrible issue. We felt like it was a struggle for the agency to figure out what people needed with COVID. And we as an agency promote professional growth and understand that that growth doesn't always have to be within our agency. We also believe that a lot of the changes that we implemented and a lot of the ways in which we incorporated the Nurtured Heart approach and the 6 core strategies and the changes in management and how we treat staff contributed to the positive results that we received. The work is tough, and we can't necessarily change the demands of the work, but we can support staff and recognize all of the work that we're doing, and we utilize the Nurtured Heart approach and 6 core strategies to do so.
So we've talked about the 6 core strategies and the Nurtured Heart approach as the approaches that we utilize for promising path to success. You've heard Deja and Stephanie talk about what that work looked like in a care management organization. The last part of our presentation really talks about that return on investment, which was both looking at the success and the challenges of the grant, as well as the system as a whole. So looking back at our initial goals of reducing the % of youth that were re-entering care after transitioning home, looking at reducing the percentage of youth who were having multiple consecutive episodes of residential intervention, looking at the goal of reducing the average length of stay to be 9 months or less, and then looking at reducing and eliminating restraint, seclusion, and coercion. Although our return on investment is not complete, we have some data that we'd like to share. We saw significant improvement in the child adolescent needs and strength domains, in particular in the life functioning, child strengths, children's behavioral and emotional needs. We also saw that the number of youth in our out-of-home treatment decreased during the period of the grant by approximately 33%. We saw that the average length of stay for youth in out-of-home treatment decreased from 358 days to 256, which was a reduction of 28% and took us under 9 months length of stay. And then lastly, preliminary findings suggest a significant reduction in the number of restraints across the programs that were implementing Promising Path to Success, averaging approximately 24 averted restraints per program based on a comparison to a group restraint incident adjusted for size over the 12 months following implementation. And so with the support and the data from Medicaid, educational providers, institutional interventionists, juvenile justice, child welfare, we were able to measure the impact of the Promising Path to Success grant, and we hope to continue to learn more information about the impact of our children's system of care. So what's next? Feedback and recommendations that we received from our partners in Promising Path to Success 1 helped us yield a second consecutive SAMHSA expansion grant, Promising Path to Success 2.0. The focus of Promising Path to Success 2.0 still takes the evidence-based practice of 6 core strategies and the language and lens of nurtured heart in doing a coaching implementation with our care management organizations, our family support organizations, our mobile response services, as well as schools that are through our Office of Education, as well as schools in our out-of-home treatment programs. We're also bringing the nurtured heart approach for all of our child protection staff, as well as our resource and kinship families, which count for over 3,000 families. And lastly, really looking to elevate and amplify youth and family voice and participation in our county-based children's interagency coordinating councils. This allows the stakeholder voice of youth and families and participation in not only the councils, but their subcommittees, and ensuring that we are identifying the proper services and supports in each individual county moving forward. Thank you for joining us today in our conversation about Promising Path to Success. We hope that you found information that is helpful in helping you look at transforming your system and the work that you do with youth and families. We can be reached at our emails on the screen. Once again, my name is Stacy Ray. I'm the project director for Promising Path to Success for New Jersey's Children's System of Care, and Deja Amos and Stephanie Suriani can be reached through their emails at Tri-County Care Management Organization. Thank you and have a great day.